Hello, you are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 15-year-old male adolescent presents with a 5-month history of inflammatory acne on his face, including papules, pustules, and comedones. Physical examination by the clinician confirmed this by seeing the papules, pustules, and comedones on the face, on the cheek, and on the nose. Now, this is the case study we have before us. Now, the first question is, yes, we understand that the most likely diagnosis is, of course, acne vulgaris, okay? Well, of course, we've seen the manifestation by way of seeing the papules, okay, and the larger form being the pustules, and of course, those with the black hairs, okay, all those, dark coloration over there, okay, those ones represent the comedones, okay, or the black hairs, those are the things. Now, the first thing is that if you've seen acne vulgaris, what is the most likely structure, okay, the most susceptible structure that is often attacks? And my friends, your answer is the pilosebaceous unit. And so my friends, whenever we talk about the pillow, then we are talking about the hair. And so for that matter, the main structures which are affected as far as the acne vulgaris is concerned is that those ones which will be involved will be, of course, the sebaceous gland itself, the hair follicle, together with, of course, the erector pili muscle, the smooth muscle, which of course keeps the hair follicle, yes, vertical to, of course, the surface of the skin whenever the environment is cold. Okay, so that is one thing that we need to understand. Now the next thing is that what is the contribution? Now we understand that is the pilosebaceous unit, especially the sebaceous gland contributing. What is the role of the sebaceous gland in contributing to acne vulgaris? And my friends, your answer is that sebaceous gland, what it does is that it produces an oily substance which we call it sebum. And this sebum, when it's produced in excess, okay, may clog, okay, may block the pores, okay, in of course the skin of the individual. It may contribute to this, of course, acne vulgaris. My friends, as far as this question is concerned, the individual is a male. Now, what is the factor being a male? What does it contribute to, of course, having this acne frequently? My friends, your answer is that yes, it can affect females, but of course, predominantly we see it in males. The reason is simple, because of the change in, of course, the sex hormones, okay, androgens especially. We are talking about testosterone, okay, in male during puberty. So that sudden change is the one which results in excess production of what we call the sebum, but of course the sebaceous gland. So the activity of sebaceous gland increases as you have more testosterone. Okay, that's also one other thing that we need to understand. Now, my friends, apart from these things we've talked about, what other factors will contribute to one developing acne vulgaris? And my friends, your answer is simple. Yes, we talk about the sebaceous gland, the pilosebaceous unit. Yes, the sebaceous gland activity leading to, of course, clogging of these pores within the skin, and therefore inflammation taking place. So the other thing is that inflammation should take place, okay, to result in these things. Okay, those are also one of the conditions that we need to satisfy. Now the other thing is hyperkeratinization of the skin. So the epidermis of the skin, the most superficial layer by way of the stratum corneum, okay, the horny layer. So when you have a lot of keratin, okay, produced over there, then that one also contributes. That one also get clogged, okay, combines with, of course, the sebum, okay, to clog these pores within the skin, leading to that kind of inflammation. And my friends, one more thing which contributes to this acne vulgaris is, of course, one bacterium Okay, although it could be a normal commensal, but then when there's that kind of inflammation, when of course we have a lot of sebaceous gland activity taking place, when there's hyperkeratinization, then of course it will also multiply, okay, contributing to, of course, this acne vulgaris. And my friends, your answer is Propionibacterium acne. Okay, Propionibacterium acne is also very implicated in this regard. So all these things will contribute, okay, to these things. So it therefore tells me that, I mean, personal hygiene, as far as this stage is concerned, is crucial. Okay, it often occurs around this kind of puberty, adolescent stage. Okay, but then if you take good care of yourself, yes, it may resolve on its own. But then if care is not taken, then you may take it, it may go with you to your 30s and even your 40s. Okay, these are the things. And so one thing is that you need to properly take good care of it. When the need arises, you see the dermatologist, of course, they may prescribe some topical, creams for you. And then if the case, maybe if it's not resolved, maybe sometimes you may be giving some oral medication, okay, to help, reduce this kind of inflammatory acne. My friends, I believe you find this meeting helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.